So I'll be speaking, the last speaker really set me up nicely for the talk that I'm going to give, looking at obesity in people living with HIV and also young people who are HIV negative. So this map that we are seeing, it's different shades of blue and green or teal depending on your color palette. And the darker colors are seeing where we have higher rates of obesity in the world. So as you can see, certain parts of Africa, if we look at Southern Africa, the US, India and so forth, we have high rates of obesity. So we often see a heat map when it looks at HIV, but when it comes to obesity and non-communicable diseases, Africa is just as vulnerable. So currently, we have about 2.2 billion people living with overweight and obesity. And when we think of young people, currently we've got about 430 million people living with overweight and obesity, and that's set to double, almost double within the next decade. So I just want you to just think about that, because you know we think about HIV stats a lot. We've got approximately 40 million people living with HIV, and just looking at adolescents and young people, we've got 100 times, 10 times as much. So it's a, no pun intended, obesity and its associated non-communicable diseases, and they particularly impact low and middle income countries as we are going through an epidemiological transition. Our food is different, our lifestyles are different, and because of that, we are gaining weight, and and it's also coming with the economic toll as well. Africa is the youngest continent. The average age is about 19 years. And if you're looking at other continents and other countries such as Japan that are really trying to have young people. So our people are our resource, but we need to be healthy for us to enjoy all the benefits of it. So the top 10 countries that have got the highest rates of obesity among young people, I'm not sure if you can see it there, but just for people to shout, what do you think would be the top country with highest rates? Okay, I'm hearing South Africa. Anyone else? The US? Okay, so looking at that list, is actually most countries are low and middle income countries. So we've got Vietnam having the highest rates, rapid increase, South Africa, India, Sri Lanka, Nepal, and so forth. So in the top 20 countries, there's actually no high income country. So we often think of obesity and its complications, especially among young people, to be something that it's the Americans, the McDonald generation, but it's actually our issue as Africans and as young people around the world. So young people are the next generation at risk. If you're looking at the dark blue line, that is looking at the projected number of young people who will have hyperglycemia. So intermediate hyperglycemia, or which is pre-diabetes, is what we see as diabetes. So if we're looking at 2025 and where we're going to have about 25 million young people who are at risk of diabetes, and 70 million young people who will have hypertension. So we are facing the first generation of young people with NCDs. So just to think about it, when we think of non-communicable diseases, who has a grandparent or parent who's got hypertension? Right? So quite a few people in the room. But we are coming to a generation where it's going to be children with hypertension and diabetes, and children and young people. So the next generation is at risk, and this is a point that we can intervene. So why is this happening? It comes from a variety of causes. Obesity, like other non-communicable diseases, is a chronic disease, and chronic diseases are complicated. So we've got our biology, right? So what happens when we work out? Anyone in January who joined the gym? Okay, how did it go? So what? We started off this year, new me, right? And I'm not sure if anyone made it to February, but what happens when we work out? we're hungrier. So our bodies are not made for the modern world. Our bodies are made for when food was not common. You had to look for food. It might be a day or two, hunters and gatherers. And because of that, it defends against weight loss. So any intervention that we do, our body fights against it. Food is delicious. If you think of ultra-processed food, the same companies, so tobacco companies, are actually the ones that have pivoted to looking at food, to looking at ultra-processed food. So that's why those chips, right? You put one in your mouth, you cannot stop. It's the same tactics. It's delicious, that crunch. At the end of the day, right? We've been here all day. I can assure you, no one will want a salad. You want something that is delicious, salty, and fatty. So there is something that is, so the food that we have is designed for us to eat it. And just like the tobacco industry, you're making a customer for life. So if you find a young person who likes, if you think of McDonald's and how they're actually the biggest distributor of toys in the world, it's to get a customer for life because it's associated with so many core memories. Genetic risk. So if I always say this to people, choose your parents very carefully. Because it can have a lot of issues for you. So obesity, most of the genes are between 40 to 70% are really not your fault. So say it to yourself, it's not my fault. But other things as well. We talk about marketing. I've never seen a marketing campaign looking at healthier foods. It's often ultra-processed foods. Sleep, we're not sleeping well. What do we do when we go in? We're on TikTok, we're on Instagram, and so forth. Less sleep. There's certain hormones that you need, and you are more likely to wake up at night, have something to eat, and when we're tired, we eat more. So all these combinations from 1 to 9 and a lot more are really priming us to gain weight. So this is another heat map that's looking at both HIV and obesity rates around the world. So this is something that we're more familiar with. And we've got a growing obesity epidemic in regions with high HIV prevalence. But as said by the previous speaker, is that a lot of our care is looking at communicable diseases and not non-communicable diseases. So integration is important. So just 50% of people living with overweight and obesity live in just 2 countries in the world, South Africa and Mexico. And weight-related diseases are now leading. We often think of TB and HIV being leading causes of death. They are not. So obesity and its complications are, and we're seeing HIV really coming at 4th. So there are some parallels between HIV and obesity. So the first one, there's similar threats to public health. So with HIV, it took us a bit of time, but we got there. We came together as a community, civil society, we had patient advocates, we had healthcare professionals, we had scientists, we all came together to do something about it. But when it comes to obesity and its complications, we have not come together as yet. So we've got similar threats to public health. Because often when we look at obesity, we see it as a failing of a person. It is because of you, you don't work out, you don't eat well. But actually, like any other issue, it's because of your environment. We've got available but underused interventions. So we've got such amazing drugs that have come up. Anyone that, we've been seeing Ozempic everywhere, right? The Kardashians are on it, Oprah is on it. It's a fantastic drug, right, when used appropriately. And we're seeing, and we've got a lot of anti-obesity drugs that are in the pipeline, just as we are seeing a lot of interventions when we look at drugs when we come to HIV. Stigma. So please do not look at the person next to you, but how do we describe people with overweight and obesity? I think in the HIV world, we are great with our pronouns. We use people first language, but how do we describe someone who's living with overweight and obesity? Often it's not in kind words. We're coming up to Christmas. A lot of people dread seeing that aunt of yours. Yes, everybody has that aunt. What will that aunt say? Oh, this year's been treating you well, etc. You see? It's a language that we use. And there is a lot of weight-related stigma. You're less likely to get a job if you're overweight. People perceive you to do worse in school, and I'll talk about that in subsequent slides. And also, we've got structural and environmental drivers of obesity. Did we walk here today? Do you feel safe walking? Can you ride a bike? Or do we sit to come here to sit, to go home and to sit? So now, changing gears to adolescents living with HIV and how the drugs can impact their weight. So we've got certain drugs, such as TAF, dolutegravir-based medication. We know that girls and young women have got higher rates of obesity, particularly if they are Black. There are certain lifestyle factors, and these cause all those complications that you're seeing on the right. And excess weight in adolescence primes you for obesity in adulthood. So as I said before when I was in my previous slides looking at the high risk, so we said we have 770 million adolescents with obesity in a decade. What will that mean a decade from then when people are going to adulthood? So we've got a looming issue that we are not prepared for. Healthcare systems are not prepared for. And as individuals, as individuals as well, we often don't have good information. And I'm not sure any of you who are studying at the moment, even in medical school, no one teaches you about nutrition, no one teaches you about obesity. So this is very important. So there are a few cardiometabolic complications. A lot of them have been highlighted. So obesity, one that you may not be familiar with, is hepatic steatosis or fatty liver, quite common and understudied, dyslipidemia, bone metabolic disorders, hypertension, and cardiovascular disease. And the weight stigma begins in childhood. A lot of people who live with overweight and obesity, just think of that person, if it was you or someone that you live with, how do we describe children? So in school, 71% of adolescents reported being bullied in school with a high BMI. So just like HIV, there's an internalized stigma. Even in school, teachers score children with overweight and obesity lower, even though we know it's got nothing to do with your intelligence. And when at home, how do your parents describe you? A lot of children are put on diets inappropriately when they're younger, don't eat that, etc. And that causes shame. And we've seen that in the HIV world. When you shame people, it's not a way of intervening well. And the cost of inaction. So this is showing what happened in South Africa, where we had delayed antiretroviral access. And that caused 300 excess deaths and about 200,000 infections which could have been avoided. We had a Minister of Health who was talking about African potato and garlic and so forth, where we had the science behind it. And this is the same thing when it comes to obesity and its complications. So the dark blue is looking at the African continent. So the cost of inaction, so if you look at that table where we are now, what will that mean in 10 years' time? And 2035 seems like it's far away, but it isn't. So we are seeing obesity and overweight to almost double in our population, and the African continent and other middle and lower income countries bearing the brunt. So as I'm coming to my concluding slides, HIV provides a blueprint for tackling obesity. What did we do to get to where we are? We used key policy levers. So we had political will, we stood up, we said we don't want to die, and so forth. We had systems, right? Demand creation. If you think of anything around, VVMC, etc., testing, there are all these campaigns that happened, and we also had a strong activist movement. When it comes to NCD, we've got a blueprint that will work, but we have to galvanize, and we have to have a similar rage. I think when it comes to NCDs, we're like, oh, these are the things that happen. We don't have the same rage and intensity, and this is, you know, it's even worse when you look at morbidity and mortality. So what can we do about it? So promoting a healthy lifestyle and make choices easy. So if we went outside, right, for lunch, I'm not sure what's going to be for lunch, you know? So if there was a bucket of KFC, or there was maybe a complex carbohydrate, I don't know, maybe, you know, matoke or something, right, that would keep us in the afternoon, what would you choose, right? But if you eliminate the choice, you make it easy for people. Education, access to information, to involve families. Children don't cook for themselves, but how are we eating in our households? People who have children, what is it that we're always done? There's a bake sale, etc. So if you go into a school cafeteria, or even young people who are at university, I work with a group with UNICEF. There are not a lot of things on campus that are healthy for you. That's why you find when people go to university the first year, what happens? People gain an average about 7.5 kilos in that first year. We need to involve our policymakers. We need to restrict harmful food campaigns, because it's no mistake, the reason that things are delicious is by design. Taxes on sugary drinks, so those are things that have worked quite well. And digital health interventions, this was spoken about in the previous session. These are some of the things that can help. And also clear nutrition labeling. So if you think of a lot of cereals that we have, what do they have at the front? They show a healthy person kicking a ball, but the average cereal that we have actually has got more sugar than a chocolate bar. We would never eat a chocolate bar in the morning, but our cereals have got just as much sugar. So the fourth 95 is something that we've talked about. We have to look at it beyond viral suppression. Good health-related quality of life means we have to live long to enjoy those benefits. So in summary, the key takeaways of my talk is that children, adolescents, and young people are actually at the center of the obesity crisis. So we think of it as being an older people thing, people in America and Canada, but it's actually us Africans who are most at risk. Obesity, like HIV in the past, is significant. It's a growing public health threat and requires our urgent action and attention. Stigma around it, just like HIV-related stigma, there is obesity-related stigma, and in our efforts, we should look at addressing that. And the success of the HIV program included a few things, and we can use that blueprint for obesity care. Thank you for your attention.